Dina, what if I were trying to sell you a pill that's helped muscle functioning, maybe decrease injury risk, maybe sped the recovery from injury, of which, obviously you're well known, not well known, but you've been going through that, and helped immunity. Like, sometimes you see all these claims for supplements like, oh, it promises all this stuff, and oh, just take this one little pill. I kind of feel like we have that one little pill for the topics I just mentioned, right? And what we're talking about is, again, vitamin D.
I was just thinking, ooh, have I been taking this pill well
Yeah.
enough before all my injury
You're like, wait
saga
a
of
second.
2024?
That's actually a
Um,
good point. Were you?
oh, yes, I
Are you
was.
are you a consistent vitamin D supplementer?
I would say so, but
Yeah.
thinking of our previous conversation with the amazing Amanda Archibald, like looking
Yeah.
at all of those other pathways related to
Yeah.
vitamin D and bone, and although I didn't have a bone injury, but soft tissue and inflammation. So I think this is where, as we've talked about in this kind of vitamin D series, is it's complex and there's a lot of interplay between with this hormone or this nutrient, whatever we want to call it
Hmm.
today, pro hormone, pro nutrient.
Pro-hormone,
I
which
know,
that's
yeah.
exactly what it is.
Yes, but to your point, the pill form of vitamin D having a role that we know, it's just there's so many layers to it as we've been trying to
Totally.
convey.
It's amazing. And it's
Yeah.
sometimes hard to describe to athletes and explain because they're like, oh, vitamin, like no big deal, right? I mean,
Mm-hmm.
I kind of maybe not the whole big deal, but who cares, right? And
Mm-hmm.
I'll just give these examples. Like I remember it, I mean, probably 20 years ago almost when athletes had something going on with their bones, i.e. like stress fracture, the
Yeah.
discussion back then was, oh, are you taking enough calcium? Right. And
Yeah.
even these days, I have a recent example with men's basketball player and a male basketball player, and stress fracture, and then some hand stuff going on, and you just like the first thing that I'm seeing still a lot of health practitioners going to is, oh, are you eating enough calcium-rich foods? Are you drinking milk? Are you doing dairy? And I feel like just, I mean, we already talked about this initially about vitamin D, but it's kind of the lost vitamin or pro hormone when it comes to injury and when it comes to muscle health and muscle functioning. And there's a lot of, listeners, I want you guys to really perk up on this episode because we're talking about not only sport nutrition, right, Dee, but we're talking about longevity and healthy aging and preventing falls and extending lifespan and health span. I mean, this is the real deal here.
Yeah. I know this is where honestly I feel like athletes we just get focused and it's okay. I mean, we don't always know different, but like we just train well and hopefully you're sleeping and that's that. Or like recover, these general like we just train.
Mhm.
But our performance and risk of injury and these kinds of things that we don't always think about until something's not going to plan. Whether that's like, why am I feeling weak? Why am
Yeah.
I, actually my performance is declining or, these things that we don't notice till they happen. Then peeling the layers back to uncover something like what it had to do with my vitamin D status potentially.
Yeah.
So, yeah, I wonder kind of delving into this more, Bob, like on the performance side or type of outcomes as it relates to performance, things that you've seen from
Yeah.
research or from your athletes.
Well, and even just to emphasize that, when we're injured, that's when we start paying attention to stuff, right?
Yeah.
So,
Yeah.
I mean, call it, and we've all been there, done that, right? I mean, and it's usually a bone injury for the most part. You're like, oh yeah, calcium, and then you
Yeah.
start Googling, and you're like, oh wait, vitamin D and all this stuff. But I feel like we should let's kind of focus on the whole muscle health first, right?
Hmm.
Because obviously, vitamin D is important for so many different processes, as we chatted with Amanda in the last episode. But really, when it comes to muscle health, we're looking at like there is a correlation between vitamin D stores in your body and muscle strength, right? And I haven't
Hmm.
read all the articles, obviously, but there are correlations between grip strength, and this isn't necessarily muscle health, but you can argue that between like VO2 max and just, I mean, honestly, just healthy aging in terms of reducing the impact of sarcopenia, which is the
Hmm.
age-related loss of muscle mass, right? So
Yeah.
listeners like, okay, great. But so here's the thing. as Amanda talked about with us, there's a vitamin D receptor, and it is in our cells, right? And interesting, in muscle cells, it's in the nuclei, right? And this is what we're talking about here, because vitamin D, because the receptors in the nuclei of the muscle cells, it can actually contribute to calcium transport, right? And okay, there comes the calcium word, right? So
Hmm.
if we can influence calcium transport in the muscle, you might be thinking, who cares? Like, what's the deal there? Well, interestingly enough, it can actually increase the binding sites of calcium on a muscle cell, which is necessary for muscle contraction. It's called cross bridging, right? And that's where we have that cross bridging. It's kind of like, I don't even know how to describe it, but we need calcium to help this cross bridging so the muscles can actually contract. And that's where I'm going with this. Low vitamin D could lead to low calcium binding sites in the muscles, which leads to low muscle or less muscle contraction. So for athletes, we're seeing not like low vitamin D could produce low power, low economy, low velocity and speed, like all these things, because at the very core of our muscle cells, this is where vitamin D is acting because of the vitamin D receptor, right? And that's from a contraction standpoint, that's really what we're talking about here. And I guess we should also say it's not 100% correlation, right? Oh, if you have low vitamin D, therefore you have poor muscle health. That's difficult to draw those lines, but it's interesting when you look at all these studies, D, because I mean, in animal and human studies, it's like the correlations are there, right? It's not the whole causation kind of a thing, but it's like, huh. And even with non-athletes, but elderly people with grip strength, right? And what do we know
Right.
about the activities of daily living? Like the first thing to go, grip strength, that actually is an all risk factor for mortality, right? When your grip strength decreases. So I don't know, it's fascinating how involved vitamin D is with muscle contraction. And we're hearing this so much these days, right? Especially on the women's side of it. I know you're obviously you can talk about this, but it's all about muscle health, build muscle, keep your muscle, which is kind of funny, by the way, because I've been doing this for 30 years, D. And I started as a strength coach and a personal trainer. What do you think the message was back then? It's the
What
same
I was
darn
gonna say,
thing that we're promoting today.
I
Build
think,
muscle.
yeah, exactly. Kind of like with the protein thing. That's not
Right,
really all
right.
that new, but
It's
okay.
not new, but I feel like this message with vitamin D and muscle health is new, right? Even though it's
Hmm.
been there, it's kind of been like underneath the ground a little bit, right?
Yeah. I'm just thinking practical, like, okay, muscle function and who needs to worry about that? I mean, this is like Ms. Obvious statement, but we're talking about all types of sports and athletes,
Yes,
right? So it
yes.
is not just our endurance lovers out there, but our team sport, our strength athletes and things. So, depending on who you are listening to this, like your ears should be perked and peaked because this can, no matter, the ability or level of athlete you are or kind of sport, it really does affect all of us in terms of that muscle function and our performance outcomes.
It can for sure. And I think it's one of those things when we talk about muscle health, it's one of those things we should always include in the conversation, right? So not just, you and I are so focused on protein, which we should be, right? I think everybody should be. But I feel like, sometimes I feel like the vitamin D story gets lost, or it doesn't even get explained because and I'm a victim of this. I push protein so much and make sure the ratio is there for many reasons that sometimes I'm like, oh, I forgot to talk about vitamin D. So I feel like what we're seeing now is an evolution of including more vitamin D discussion in muscle health, muscle functioning, muscle contraction, and even coming back from injury or maybe preventing injury, but definitely coming back from injury because when we want to shift there, it's interesting how vitamin D impacts certain things in the body. And I guess it's from a muscle health. I guess you can loop that in mitochondrial functioning, but more so like yeah, I don't want to jump the gun here before we kind of close the chapter on muscle health, but there are some really interesting things we should talk about when it comes to vitamin D and injury here in a few minutes. Do you have anything more to cover with muscle health?
I think just when you were talking about the role and tie to calcium, that we immediately just think of bone. So just re-emphasizing this is like a muscle, not just bone, which is why we
Mhm.
call it like musculoskeletal impacts
Yes.
of or roles with vitamin D in the picture. So not just bone, everyone lock that in. It is muscle. And then of course, as we may talk about here when it comes to injury, just like, oh no, now it's not just muscle and bone, it's also the tissue around the muscles and bones that hold all this stuff together, our tendons and ligaments. But that calcium piece, like there's a whole cascade if we've got this lower vitamin D status, how that like we're not going to absorb as much calcium and now our parathyroid gland gets involved and like we start
Yes.
breaking down bone to get
Exactly.
the nutrients needed for these tissues and the muscle to contract like you were saying. And so if
Oh,
we're chronically low in this vitamin D or don't understand the root cause behind it and not addressing that, geez, just this, all these other things that might be happening that we can't feel as much, Bob. Like some
yeah.
of this is like silent in a way. Like I can't feel that my bone is breaking down right now.
Right.
It's
Exactly.
only when I start to suffer in injury or, yeah, weakness when trying to.
Yes.
So, yeah, that was all I wanted to add.
So you may just feel like, man, I'm getting weak and then blame it on age, but it honestly could be an imbalance in vitamin D, like a deficiency, right? Which is crazy to me. But I want to highlight what you just said because I think it's a good lead way into injury because I just want to emphasize one more time because I heard you say that and I think it's super important for our listeners to know this. So you were talking about like when you have lower vitamin D levels it increases your parathyroid hormone. And listeners, this is what I want to just emphasize that increase these things called osteoclasts, which actually break down collagen in your bone.
Yeah,
So by having low vitamin D, that stimulates another hormone, parathyroid hormone, which will stimulate another thing that will break down collagen in your bone. And no, you can't just supplement with collagen and fix this whole thing, right?
right.
It just doesn't work like that. But I think it's really important. Like we're not just saying, oh, hey, low vitamin D means increased risk for whatever. I mean, there's actual biochemistry here. Like there are metabolic processes and pathways that are going on. And that's why we emphasize I feel like a lot of our listeners are going to go get their vitamin D measured, but that's why we emphasize getting your vitamin D measured frequently. I mean, I usually have it measured at least once, if not twice a year. I've got a good handle on what my levels are already, so I don't have to measure them as much. But okay, so that's where I want to transition into injuries. So we know this in terms of bone health. Here's another thing though, if like vitamin D is actually known as an anti-inflammatory and an antioxidant agent, right?
Yes.
Prohormone, call it whatever. So not a lot of people, when we talk about inflammation, we're like, oh, eat some omega-3 fats, have some spices, it's all great.
Eat your
Vitamin D usually,
blueberries.
yeah,
Yeah.
right? I mean, how many times are we like, oh no, what's your vitamin D level? Like, when we look at blood work, and there's actually been documented, research that shows that improving vitamin D stores will reduce inflammatory markers in your body. So I just, listeners, I want to make sure that you understand that vitamin D, because of the vitamin D receptor, specifically the expression of this receptor, we're talking about reducing reactive oxygen species, reducing inflammation. We're talking about really trying to prevent or increase the antioxidant capacity in the body. And
Mhm.
that all helps. I mean, yeah, we're talking about sport here because sport nutrition, but it helps with everything, and
Yeah.
especially in a stressful lifestyle because we have all these high stress markers, these blood markers that are showing up. So again, it kind of comes down to I kind of look at this and if you were to ask me, oh, so is vitamin D the answer? No, it's not the only answer. It's part
Yeah.
of this entire very complex process called biology, right? But I feel
Right.
like, man, with injury risk and anti-inflammatory and antioxidant capacity, and listen, it's not going to prevent you from being stupid and twisting an ankle on a trail because you're not watching where you're running or whatever. But it's helping to build these structures in your body to be strong.
So important, Bob. And I think I can't recall everything we touched on with Amanda, but the point she was also trying to make is with these genetic variants and like there's more than one pathway that's affected, but to your point too, with the inflammation and antioxidant influence of vitamin D and how that can impact the various pathways, like it's oh gosh, I was going to try and spew out some like 8 syllable word, but I'll
Yeah.
pass on that for a second and just make it known, or stating once again that this inflammatory state that we can get in for different reasons is highly influenced by vitamin D and this receptor that you're talking about, along with those other gene variants. So, should we talk about the injury bit here
Yeah,
since
for sure.
it's
I mean,
tying all together?
yeah,
Yeah.
absolutely. I mean, I feel like I'm going to let you contribute a little bit more, but I feel like, what I've read, there's actually data that proves that there's actually faster recovery from injury when your vitamin D levels are normal. And of course, I believe we talked
Mm.
about that in episode 1, what normal is and what our
Hmm.
ranges of normal is are for athletes. But I find that fascinating. And granted, there are so many things that interact how an athlete recovers from injury. We know that, right? But in my mind, and then I'll pass the baton on to you, Dina. In my mind, if you can influence your recovery from any type of injury, because again, as we've said, vitamin D interacts with so many different processes in the body, but if you can help your injury rehab just simply by by increasing your vitamin D status through food, through supplements, to me that's a no-brainer because it is not difficult to do. Okay, that's what I wanted to say, but I feel like it's really important to know that vitamin D, proper vitamin D stores can decrease the time from injury or for injury rehab so you can get back on doing what you want to do faster.
I was kind of thinking on the other side, like before I'm injured,
Oh yeah.
or just appreciating again this role and potential impact upon injury, though, as you said earlier, Bob, it's not cause and effect necessarily or outright,
Yeah.
but
Right.
when they look at athletes who are injured, and I made a list of the types of injuries or the body parts that are, have been looked at with
Yeah.
the association of vitamin D levels that I wanted to touch on just because it was like, holy moly, this is a long list. So, lower extremity injuries have been looked
Mm.
at more just because that impacts, most sports, right? But
Yeah. Yeah.
like ligaments, cartilage, patellofemoral issues,
Mm.
bone stress, and then, of course,
Hmm.
fracture. And then we've
Yeah.
got ankle sprains or other ankle injuries. We also have issues in the feet, which could be,
Mm.
again, bone or other tendon issues, hamstring injuries, and then just acute, maybe other muscle issues that not just hamstring. So like
Wow.
there's it's kind of like every body part have this association between suboptimal or deficient
Mm.
levels of vitamin D. And so again, not cause and effect, but it's just something to be highly aware of if you are
Yeah.
someone listening to this and you've like, man, I've had a lot of ankle injuries. Maybe you haven't looked at your gene picture, you haven't looked at your vitamin D and, done a nutrition assessment. This could be a big light bulb moment to prevent potentially risk for this injury reoccurring or
For
recurring.
sure. And I feel like I want to push the easy button now because I feel
Yeah.
like it's easy, right? So here, personal example, I've through my ultra running, I always use career, but it's not a career. Times, right?
Yeah.
I've had Achilles issues, like major Achilles issues in both
Uh-huh.
my Achilles. And this is how I want to package it. If you were to tell me as if you're my sport dietitian, you're like, hey Bob, um, you can actually you can actually decrease risk for this or help speed your recovery from Achilles injuries by simply one, knowing what your vitamin D status is. And if you need a supplement, take this little pill every single day or you can spend 4 to 6 months doing eccentric calf exercises, 3 sets of 20, 3 to 5 times a week. Which one do you think I'm going to think is easier, Dina?
I'm gonna vote for that little pill.
You see what I'm saying? Is a lot of people are like, just give me a pill.
Yeah.
Listeners, we are literally setting you up for that. Like we never ever say, "Oh, just take a pill." But this is probably as close as we're going to get. Like if you're deficient, we're going to tell you, "Oh yeah, this could actually not solve your problems, but it can impact so many different health and performance pathways in your body." It is literally not even funny. It is the biggest no-brainer that I can foresee here.
Although I will like, okay, careful, Bob, because then everyone just starts vitamin D, like, oh, I'll just
Right,
grab
right.
this pill
Yeah,
and just two things. One is, yeah, it's not cure all necessarily, but the second thing, just reiterating some of the points Amanda was trying to make here in that recent episode is like there are many other reasons we could be low in vitamin D, not just the that we're not taking enough of a supplement or not
right,
enough
right.
sunshine. So just that, like, if, yeah, I would just work with someone to really get to the root of it and then know that you're properly supplementing if that's appropriate.
Yeah, and again, it all starts with testing
Yeah.
first.
Yeah.
Always, always. And the beauty is this is probably one of the cheapest biomarker tests you can do on its own, like
Yeah.
literally,
I
right?
think it's
You
like
go to your physician.
30
Yeah.
to $40.
Yeah, and that's if you go out of pocket. Like maybe your
Yeah.
insurance covers it. Like it's so easy to do. But I totally agree with that, Dean. And I'm just gonna put this out there in for our Patreon members. Thank you everyone for joining our community, by the way. But for our Patreon members, I'm actually gonna share a little case study that I did with a group of athletes to show the power of all of this that we're talking about in terms of testing and measuring and supplementing in a very short amount of time. I'm going to share an amazing kind of group of case studies so you can actually not only hear about the success, but also maybe follow some of this if you are lower via blood work testing. So
Mhm.
head on over to our Patreon account and we'll tell you more all about that in the show notes and stuff. But I just want to throw that out there, Diaz, because I've done this before with many teams, many athletes, and have had humongous success most of the time, right? There are those
Yeah.
times, like Amanda was saying, that's like, whoo, can't figure this one out. Maybe there's
Yeah.
something else going on here in the genetic pathway, which is, of course, can everyone tell how just big of proponents Dina and I are of testing things for your body?
I don't
Because
know.
seriously,
Heck
right? You just don't
yes.
know. You don't know if you don't know what you don't know until you know. And
Yeah.
that's you gotta know, you gotta test to know.
Yeah.
Anyway, we
Mhm.
are going to share that in the Patreon community because I feel like that's a real special, just kind of an eye opener.
Yes. I am excited for that. And maybe we should just add a note here, Bob, before we wrap up about the role of vitamin D as it relates to the immune system.
Oh, yeah, do tell.
We touched on a little bit in our previous episode, but just the impact on, as we are talking about inflammation and oxidative stress,
Hmm.
and knowing that vitamin D can be anti-inflammatory or have this antioxidant activity in the body is also not just your risk for injury or how well you may rehab from your injury, but your immune system. So there are some research papers out there showing, again, a correlation between, I guess we're talking about illness and some of the other immune system impacts, but seeing
Hmm.
again that correlation between low vitamin D status and risk of compromised immunity. And then I found this interesting, Bob, is like when we talk about us athletes, is like, our exercise can be very anti-inflammatory. This is a positive activity for the body to engage in for a number of different reasons. But if we are potentially in that kind of overstressed state in terms of like a
Hmm.
lot of training, we're not recovering well, and then you add on possible nutrient deficiencies or some of these other things and look at your vitamin D status. If it's low, like they tend to see more upper respiratory tract infections and some other signs of compromised
Hmm.
immunity. So that's just something to be aware of. Like it's not just injury, it's also this ability to, be robust in your
Yeah,
immune system health.
it's a good point. I mean, that's one of the first areas I'll go when an athlete presents illnesses or just says, "Hey, I really get sick a lot. I don't recover
Yeah.
that well." I go to the gut first, and then I go to vitamin
Hmm.
D,
Yep.
right? And it's like, okay. what's going on kind of under the hood, right? So I think
Hmm.
that's really important. I remember just again to kind of finish this up, but a little side story during COVID, right? This is what really got
Oh,
my
yeah.
attention because that's when a lot of vitamin D research actually popped up. Obviously, it was centered on COVID, but in that's I feel like when vitamin D really got known in the immune system response. So it was just a
Yeah.
few years ago, and now it's like it's kind of front and center with vitamin D in immune system. So boy, D, we've got immune system functions, we've got muscle functions,
Yeah.
injury functions, all of vitamin D or vitamin D status, I should say. So I guess, if you want to improve on this, really the first place to go is probably to blood test, right? Or your
Hmm.
doctor somewhere. Like you have to know what you're starting with first, right?
Yeah.
And
Yeah.
to your early point, please just don't start supplementing with vitamin D because you just don't know. Like it is there are toxic levels, right?
Yeah.
It is a fat soluble vitamin, so you can store it and too much is not good. Just like too little is not good. So have it measured first. And that's just
Right.
to me, that's the easiest first step.
Yeah. I have that on my agenda here, Bob, as and as we're recording this, it's mid-January, but I haven't had mine tested in a little while, and with injury recovery and all hopeful athletic aspirations and pursuits for this year, I have this on my personal to-do list as
That'll
well.
be
So I'll
amazing.
report back.
Absolutely. Perfect.
Yeah.
All right, listeners. Well, hopefully that's enlightened you a little bit on our vitamin D, really our series, right? We've done, I think, a pretty decent job in uncovering this prohormone or vitamin or whatever you like to call it. But hopefully you just realize that there are many functions of vitamin D. It's much more beyond just bone health as we've known it in the past. And you know what? If you have questions on this, just send us questions. We'd love to hear. You can also reach out to us on our Instagram account, which is super easy. And or you can head on over to our Patreon account because Dina, this is where we're starting to share a lot, right? And it's, as everyone knows, we're a non we don't solicit any sponsorships on our podcast, right? It's just down to earth. Dina and I, we're not taking any money from anyone. But if you would like to help us out and so we can continue our podcast, we're really bumping up our Patreon account. So we're trying to provide some real special behind the scenes. We've got a couple of different memberships, monthly memberships. And, you know, I'm kind of biased, D, but I kind of feel like it's definitely worth what, maybe less than a cup of coffee, how much you would pay for a cup of coffee per month
Oh, for
if you're
sure.
going out, if you're going out.
For sure. I just wanted to give a shout out to a couple of our new members that are in one of the paid memberships, Bob. So Linda, Ty, Mark, and Nicole, we just want to thank you so much for joining the community. It means so much and really does help us with the operation and continuation of our pod. So thank you so much for that.
All right. So, everyone, thanks for joining us once again. Cannot wait to have you engage in our next episode.
And we'll see y'all on the next one.